G'day everyone, welcome back to the channel. So today's video is for anyone that has glute pain. And that can be glute pain while you're exercising, it can be glute pain while you're sleeping, it can just be general glute pain as a whole. Because what I want to do today is I want to give you a really strong understanding of what the cause of that glute pain is. And then I want to go through 4 really helpful things or ideas that you can do to solve that glute pain. And I'm not talking about something to help that pain go away. I'm talking about things that will hopefully fix that glute pain for good, because in order to fix that glute pain, we need to understand what's causing it. And then once we treat what's causing it, as well as the symptoms that you have around the glute, then hopefully you'll have a really great program, or at least the makings of a great program that you can just keep chipping away at to conquer that glute pain long term. So before we get into it, obviously, please let me know in the comments down below what you're dealing with. What's going on with your glute? Is it tied to any specific diagnosis? Is it weak? Is it just painful? Let me know down below. Obviously, if you're going to enjoy the video, please leave a like down below and consider subscribing to the channel if you're new. Coming back to this glute pain idea, what we want to talk about basically is the cause of glute pain is generally low back related. Again, if you didn't know that, that may be news to you. If you did know that, then again, hopefully this will help you going forwards. But what a lot of people don't necessarily pick up on, or when you're having it treated, what we tend to do in the industry is we tend to focus very specifically on the area that hurts. So if your glute is giving you pain, we tend to really look intensely at that glute just to see what's going on there. We might scan it, we might inject it, we might give you some pain medications for that. But without taking a bit of a broader step back and understanding why a glute can become painful in the first place, it can be really hard to solve that really quickly and to solve that permanently, which is exactly what I want to help you do today. So, I guess the only piece of equipment that you'll need for this video is a ball. So we're talking tennis ball, this is a lacrosse ball. If you've been following the channel for a while now, you probably guess what we're going to do with the ball, but any type of ball that you feel comfortable, again, you'll see in a second when we get to the exercises, but we want to make sure that you can find the spots that you need to. We can use a ball to basically free those up really quickly. So just to backtrack a little bit, when we're talking about the cause of glute pain, we need to look at the lower back for one really important reason, and that is that there's a whole bunch of neural connections that come from the back, very specific sections of the back, that flow down to the glute and control that glute. They give the glute muscle tone, they ask it to contract and relax when it needs to, and it can also be the source of pain when there's some higher dysfunction. Now, from what I find clinically as a physio, the base of that rib cage, that sort of T12L1 section, tends to house the dermatomes, that fetal neural connection that connects to the top of your hip and those glutes. And we're going beyond like the gluteal nerves, which are a little bit lower down. So what we want to basically get you to do is we can take a tennis ball or a lacrosse ball, we can start about mid to low thoracic spine, and we can start to work our way down the levels to see where you feel is most stiff and tight. And then when we get to that sort of L1, L2, L3, L4 level, we can compare all of those together and see what makes the biggest difference for you. So for me, I would hazard a guess and say that when you get to the base of that rib cage, so that T12, L1, L2 level, you might find that's where the most stiffness and tightness and possibly tenderness may reside. And clinically, I find when freeing up those areas, it becomes really easy to get that glute pain to settle, because we're getting to the root cause of where that glute pain is coming from. We're not just doing some piriformis stretches or some glute massage, which we'll get to in a second. We're doing everything that's needed to get that glute to go away and feel good permanently. So how that essentially looks, and again, for anyone who hasn't seen this before, it's a fantastic exercise. It's one of the best exercises that I think you can do from a musculoskeletal health perspective. What we're going to get you to do is take the ball, place the ball, as I said, at sort of the base of that rib cage. So we're not going to go down at the lower back just yet. We're going to start around about the base of that rib cage, right in the middle of the spine. And we want to get you to roll off to one particular side. And it doesn't matter which side it is yet. So if you have right-handed glute pain, we can get you to start on the left-hand side of your spine if you want to. Because what we want to do with this ball is when we're in the middle and then off to the side a little bit, we need you to lie down on the ball and gently let the ball press into your back. Now, the most important thing to go through with this exercise is, as always, we're actually looking for stiffness and tightness more than tenderness and pain. Now, we definitely want to respect where that tenderness and pain might be, but the priority here is to mobilize restricted areas. So if you find that your glute pain is on the right-hand side, but you come across to the left-hand side at the base of that rib cage, and you feel like the ball doesn't sink in very well, it feels a bit stiff, it feels a bit restricted, and then you roll across to the right-hand side, and the ball feels like it sinks in a bit easier, as I get hit by something from the tree. The ball may feel like it sinks in a bit easier, and there may be a lot more pain associated with that. You may even hit a spot that refers that pain to your hip and gives you that immediate connection. But for the purposes of this exercise, we want to get you to spend time on the side that feels the stiffest and the tightest. So we don't want you to be on that right-hand side if it's just painful. If it's painful and stiff and tight more than the left-hand side, then absolutely. But we want to follow where you feel the ball doesn't sink in very well, and avoid the areas where you feel like it does sink in very well, because we don't necessarily need to be there. So again, for the purposes of this exercise, we're not rolling around on the ball, because we're trying to bias specific spinal segments or those spinal joints between those segments. We need to make sure that once we find that restricted area, we stay there for 30 seconds, a minute, as long as you feel comfortable staying there until that tissue starts to give. Then once you feel like you've had an impact, then you can move the ball down a little bit or up a little bit, or even out to the side a little bit more onto the rib cage if you're still on the rib cage, and go hunting for those areas that you feel are really important. Now, as I said briefly before, you may find you hit an exact spot that communicates with that hip. Maybe it reduces your pain slightly, maybe it increases your pain slightly. Anything that gives you some of your symptoms is a really important area. That tells me that's potentially where it's coming from. And it's important because a lot of people spend all their time down at the base of their spine, at that L4-5 area. We do it in the under the idea that the sciatic nerve is the problem, and it could be potentially. But if you put a ball in that area and it sinks in easier than it does higher up, then you might find it may actually be coming from higher up. So it's really important that when you're doing this exercise, that you take the time to segmentally to go onto one side, see how that feels, compare it to the other side, see how that compares. Stay on the side that feels like it doesn't sink in the easiest, it feels a bit more restricted, a bit stiffer, and then slowly work your way up or work your way down from your starting position so that you're capturing all of that stiffness and tightness. And you should hopefully feel that even after just doing that alone, it may have an immediately effective impact on how your glute feels. So it's a great way to take all the guesswork out of things. It's a great way to understand specifically where the exact area of your spine is that's generating that glute dysfunction. And then it's a great way to systematically free up those spots. You don't have to trust anyone. You don't have to get any sort of false promises or fancy gimmicks. You can just see exactly what's working for you. So again, figure out where it's stiff and tight more so than tender. Again, it can be on the same side, but in the off chance that it isn't, prioritize stiffness and tightness. Just go to town on freeing that up. And hopefully you feel that'll have a really big impact on your glute pain. So that's exercise number one. Exercise number two, we want to take that ball and go hunting for your glute symptoms. And the reality of having glute pain essentially is if your back has been causing glute dysfunction for a long time now, that glute is going to become dysfunctional on its own, in its own right. So you might find that wherever that glute pain is, the muscles in that area may become tight and sensitive as well. Again, when you get a massage, I'm sure it feels a bit tender, but we can do that at home with a ball. So again, you can use a tennis ball. This again is the lacrosse ball, but you need to make sure that you use a ball that is comfortable for you. Because remember that any pain isn't just a tissue-specific system of events. It's basically your brain and nervous system's perception of threat. So if you jam a ball into your glute for the purposes of trying to beat it up and free it up under a lot of pain and duress, your nervous system isn't going to feel safe enough to release that muscle quickly or to decrease your pain experience quickly. So make sure that you choose an object or an item that is soft enough, that respects how you feel. You don't have to be a hero. There's no brownie points for punishing yourself. You want to find a ball that allows you to get into this area respectfully so that your tissue can give and feel safe a lot faster. So again, the majority of people will be tight in that piriformis muscle, so we can put the ball in that area. Again, we can just lie straight down again, and we can roll just gently onto that spot and go looking around to see what you feel is there. Again, be very gentle, be very respectful. And we want to go about this in two different ways. So once you find a spot that feels quite tight, potentially tender, again, we don't want you to roll around on the ball. I just want you to stay there and let the ball sink into that glute muscle. And then we want to come at it in two different ways. So the first technique that you can try, and choose the best one that works the best for you, is wherever that muscle feels a little bit tight, Just let the ball gently press in. Then what I want you to do is tense that tight muscle underneath the ball. Hold that for about 5 seconds. You'll feel like you'll almost push the ball away a little bit. Then once you've done that for about 5 seconds, when you relax, you should feel like the ball actually sinks in a little bit further second time round. And hopefully it feels a little bit less tender than it did before. We can get you to keep repeating this process. Squeeze the ball, so squeeze the muscle underneath the ball. Hold that for about 5 seconds, and then when you relax, again, the ball should feel like it sinks in a little bit deeper. Again, this works on a principle where when you actively activate and tense a muscle, it then relaxes at a really strong level. So it allows this tissue to release and free up a little bit faster. So that's technique number one. The second technique that we can get you to do here is we can use movement to shear free that tightness. So again, if you have your leg out straight, we can get you to rotate your leg in and out, or we can get you to lift your leg up and down. We can really try and shear free some of that tightness in between the ball and your hip bones. And it's a really great way of using movement to floss that tissue free and free up that tissue relatively quickly. So we can get you to do it by extending and flexing your hip. We can get you to rotate your hip in different directions. We can get you to rotate your hip in different positions. Again, the idea is to shear free some of that tightness. And the same thing again, you should feel like that, how you felt when you started the exercise is different to how you finish the exercise, where it should feel a little bit less tender. You shouldn't feel battered and bruised. That's not the point of the exercise. But hopefully you'll feel like you can hit the exact spot that feels symptomatic for you, and just work a few techniques there to free that up and release that and desensitize that tissue as well. So that's point number two. The third thing that we can also do is we can get to those tight glute muscles and get them to stretch. So we want to put you in a position that stretches those muscles really well. Now, I'll do this on the ground, but you can do this on a chair or a table if you want to. And we're going to do the pigeon stretch. And all that pigeon stretch basically is just externally rotating your hip underneath you. So again, if you're up on a bench, it's going to be a bit easier for you because you'll be upright. But for me and anyone else who can get into this position, we want to get you to try and drop that knee towards the ground as far as you feel comfortable, and really try and find where that tightness is. So like any stretch that we get you to do on the channel, it may be a little bit different for you in terms of where you feel that stretch compared to someone else. So if you know where your tight spot tends to be in that particular area through here, then what we can do is instead of just dropping straight down, we can get you to rotate a little bit more towards your knee or rotate away from your knee a little bit more. Just try and find the position that you need to get into that really biases your version of tightness. And then once we get here again, we can use the same principle that we did with the ball, where wherever you feel your best stretch is, we can tense up that muscle by either pushing your foot down into the ground or just physically trying to tense that muscle if you can do that. And hold that for about 5 seconds, get that muscle to contract maximally so that when you relax, it relaxes maximally, and you might find you can drop down deeper into the stretch than you could before. So again, it's really important to make sure that you can try and find any of those reactively tight muscles and just respectfully get them to release. It looks relatively brutal when you do the pigeon stretch on the ground, but when you do it up on a chair or a table, it's a much nicer position to be in because you can modify how far into the stretch you go a lot more easily. But again, make sure you tense and relax that muscle for a few seconds just to make sure that it does give relatively quickly. So again, we've talked about the low back component to glute pain and how to free that up with the ball. We've talked about trying to free up some of that symptomatic pain with the ball and some of those symptomatically tight muscles with the ball. The fourth and final thing that I wanted to cover in this video is if we want to solve this glute pain forever, if we want to take you from being someone who has had glute pain for a while to someone who used to have glute pain and hasn't had it since, we need to have a conversation surrounding why all this is happening in the first place. And I think the most commonly missed and underrated quality of glute pain, for example, is your spinal posture and spinal shapes. So when we're going through the ball exercise for your low back, if you found that low section of your rib cage and the top of your lower back is the stiffest section for you, like we say a lot on the channel, there has to be a reason why that particular part of your body has become stiff and not the section above it or the sections below it, or why the left side's stiff and not the right side. And if you found exactly where the spinal segment is that relates to your glute pain, we now have to have a conversation as to why that specific segment has become a problem in isolation when everything else is relatively good. So when we're looking at the quality of your spinal shapes, and for most people that I would talk to clinically, the number one cause of that sort of segmental isolation is your sitting habits. And we're not just talking about lifting heavy or bending over and doing hard work. Most people actually cultivate this dysfunction from just the time that they spend sitting throughout the day. And when you think about the amount of sitting that we do each day, and the average person can sit between 6 to 14 hours a day, potentially, depending on what they do with their lives. But we're talking, sitting on the couch watching TV, sitting down at a desk is obviously a big one. You sit in the car and drive around a lot, that's obviously a big one as well. A lot of people sit up in bed and read in that sort of half sort of sitting, half lying position. And the really important thing about that is that if you're constantly in a position where you've kicked a hinge, or if there's a particular hinge in your spine, and you stay in that position for a long period of time, and then keep coming back to that position throughout the day and consecutive days, your body then has to react to that shape. And if there's excess load going through an individual section that you've hinged through, your body's response is to reinforce that by stiffening up the joints and tightening up the muscles. So if we're trying to get this glute to ultimately stay good forever, then clearly we need the glute to be functioning well. Then if we take a step back, we need to make sure that the low back is functioning well. And then if we take a bigger step back, we need to make sure that you are aware and valuing the positions that you put your back in throughout the day. Now that may mean that, again, you don't have to get rid of your chair and get a new one, but if you know that this is a good sitting position, but you find yourself gravitating into this position, sort of sitting on the couch, then you've got to do something to make sure that you can keep that back a little bit straighter and take the hinge out of your lower back and put it back into your hips where it should be. And I think that's a really important conversation to have, and it's not one that we have enough in terms of trying to help you solve that glute pain. But hopefully you can see how important that is for short-term health of your back and your hips, but also the long-term health as well. So I hope that was useful. Again, please let me know in the comments how you're going. Leave a like on the video if you found it useful. And obviously subscribe to the channel. If you like this kind of information and you want to get some more depth to your understanding of why you're in pain, as well as what you can do to fix that, then please subscribe to the channel as well.